Hello and welcome to Pharmacy Skills Calculations Deep Dive. So in this video we'll be looking at the amount to give, or we're looking at the standard prednisolone type of question. I pulled this question from pharmacyskills.com. If you go over to pharmacyskills.com, you'll find that under the math section there's actually all the calculations that have been divided according to the category they belong in. So say you struggle with infusion type questions, you can just go and do infusion type questions, or maybe you struggle with dilution questions, do those types of questions. Or you struggle with using formula, you struggle with calculating kidney or renal function type questions. That's perfectly okay. So this time I went for the amount to give type of question, all right? So we've all seen this question before, it's nothing new, but how many of us really understand why this question is even in the exam? Well, for one thing, you need to understand what steroids are and what they're for. And it's quite important as a future pharmacist that you understand the basis of the calculation you're doing. So I'll give you a quick overview. Steroid tablets, and for those who just want to skip to the calculation, go ahead. Steroid tablets are a type of anti-inflammatory medicine used to treat a range of conditions such as allergies, asthma, eczema, inflammatory bowel disease, and arthritis, and so on and so forth. Steroid tablets, of course, are only available on prescription. You can get them as dissolved liquid. They have various formulations, but the most common ones are prednisolone, betamethasone, and dexamethasone. So the real question is, why this question, and why would someone be on a reducing dose? Well, the thing is, steroids are actually hormones that your body produces naturally, and they're essential for life. So when you're on a steroid treatment for more than a few weeks, your body gets all its steroids from the medication you're taking. This means that your body stops making its own natural supply. Isn't that fascinating? Now, when you no longer need the steroid medication, the dose has to be reduced gradually. This is because it takes time for your body to readjust and start making its own supply. If you just stop suddenly, you won't have any natural hormone supply, and your body needs it. If your body doesn't have enough steroids, you can become seriously ill. And it's important that, the patients follow their advice. So this is the reason why we have this 44-year-old patient who's been prescribed a reducing dose of oral prednisolone tablets. So we're told that he's taking a strength of 5 milligrams. They come in various strengths. So when doing this type of question, it is important that you understand what the question is actually asking for. Is it asking for a number of tablets? Is it asking for the days to complete the course? Is it asking for the total strength taken over a certain amount of time? There's a number of ways they could ask this same question. Don't think they're all the same. The most important thing is, do we have an efficient exam ready technique to do this question so that we can do them in the shortest amount of time but with the highest accuracy available? Over the years, I think there's no other better way of doing this question than just to write it down and do it stepwise. Yes, it takes a while to write them all down, but that's what you have to do. And if you do it so many times, like if you go to Pharmacy Skills and you do this specific type of question over and over again, you build the resilience to start writing these down, and you build the accuracy. You start to realize some of the common pitfalls you were falling for at the beginning. For example, myself, it used to be a thing whereby if I see a question like this, where he's being given 25 milligrams daily for 7 days, and then he's reducing by 5 milligrams each week. So instead of reading 25 milligrams daily, I would read 25 milligrams for 7 days. So it would be 25 milligrams for 7 days, and then 20 milligrams for 7 days total, right? But the thing is, it's actually per day for 7 days, and then he reduces per day for 7 days. So just things like those. So how would I go about doing this question? I'll start by writing it down. First thing is, we know that he's going to take a certain strength, right? He's going to take a certain strength each week. Oops, a daisy there, right? So he's taking a certain strength each week. He's taking 25 milligrams to begin with. But the question is actually asking us for how many prednisolone 5 milligram tablets. I got slightly interrupted there, but yeah, the question is asking for how many tablets. So we want to know the number of tablets. So we need to convert this into a number of tablets. So how many tablets are in 25 milligrams? Well, we know there's 5 milligrams per tablet. So it's a simple division. You have to divide 25 divided by 5. And the total is 5. And you can always double check that going backwards. 5 times 5 is 25. So you're correct. But remember, don't be like me and make that crucial mistake. Remember, this is per day. And he has to take this for 7 days, right? It says daily for 7 days, okay? So that means he's going to take this 7 days. He's going to take 5 tablets. But he's going to take that every day for 7 days. So we do the math. We just multiply 5 times 7. And you get 35. Congrats if you got this. All right. So the next step would be to just rinse and repeat. So now we have to reduce the dose by 5 milligrams per week, right? So now the dose is going to be 20 milligrams. And it's important not to overthink this kind of question. Just keep it simple, right? He's going to take 5 milligrams and he's going to reduce to 20 milligrams. Don't be thinking about half days, in between days, you know, just don't overcomplicate it. It's very simple. They really just want to check that you're careful with your math, because at the end of the day, you will see this kind of prescription in pharmacy, and you will have to double check what your dispensers are doing with these kinds of prescriptions. Especially this is a very common one, reducing doses. So we have 20 milligrams. And now we know that 20 milligrams translates to 4 tablets, because 20 divided by 5 is 4, right? So that means this is a total of 4 tablets taken for 7 days. So I'm just going to speed things up here because I think you see the general pattern, right? So the next one is going to be 15 milligrams. Then he's going to take it for... Actually, don't do this, because what I was going to do is go down and write all the strengths. I would say go through it one by one, me personally. But whatever you do, use the same technique each time, right? If you want to go down and write the strength, that's fine, but be consistent with your technique and make sure you perfect your technique. So the way I'm telling you to do it, if you want to follow me, just do it one line at a time, okay? So I'm 15 milligrams, that translates to 3 tablets times 7 gives us 21. 10 milligrams, 2 tablets times 7 gives us 14 tablets. And then we got 5 milligrams. This is going to be the final week, because he can't reduce anymore, right? He has to reduce by 5 milligrams each week. If he reduces 5 milligrams, then it's basically over. This is the part don't complicate this. After this, it's finished. So that's going to be 1 times 7. Oh boy. And then this is going to be 7, okay? So then all you have to do is add all this up together, total. And I know some of you are like wizards when it comes to mental arithmetics, but I recommend you pull out your calculator and you do the math. It's important that you eyeball it and have a rough number in mind, something you're expecting, just so that you can know if the calculator is telling you fibs. But in this instance, you just look at them, calculate them. I say use a calculator. And 105. Okay, so that's the total, and you're done. And move on to the next question. Don't waste any more time. All right, so subscribe if you haven't, and remember, we'll be tackling several more questions from each category. Again, I pulled this question from pharmacyskills.com if you're interested in learning more, if you're interested in doing the math, if you're interested in the clinical side that I went over at the beginning. All of that can be found at pharmacyskills.com. Remember, we're here to help, so feel free to ask any questions.